Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled Implications of Weighting Issues Associated with the 2018 NSSRN, and it was presented by David Auerbach on January 14th, 2021, with special guest moderator Peter Buerhaus. All right, first of all, for those of you in the audience, thank you for joining our event today. My name is David Armstrong, and I'm with the Health Workforce Technical Assistance Center. And today's webinar is the first in a three-part series on nursing research using the 2018 National Sample Survey of Registered Nurses. And today's event focuses on implications of weighting issues associated with the 2018 NSSRN. In next week's event, we will look at NP research using the NSSRN, and our final event will be in mid-February, February 18th to be exact. And on that event, we will look at RN research. Now, our presenter today is David Auerbach, and David is working out of the Center for Interdisciplinary Health Workforce Studies at Montana State University College of Nursing. And he's joined by his colleague, Peter Buerhaus. And Peter's agreed to be the moderator of all three of our events. And so thank you, Peter. We really appreciate that. And Peter, of course, is also out of the Center for Interdisciplinary Health Workforce Studies at Montana State University College of Nursing. And unlike David, Peter actually lives in Montana, so we're going to give him some credit there. And with that said, I think I've hit all my talking points, so I'm going to go ahead and turn the event over to Peter. And Peter's going to talk a little bit about the NSSRN, and also the importance of this webinar series. Peter?
Hey, thank you, David, and thank you for your work and effort to bring this webinar series alive, and as well as with Jean Moore and the Center for Health Workforce Studies in New York. I am broadcasting live from Bozeman, Montana. The sky is nice and blue, no snow, fortunately. And I'm really pleased to be the moderator of this webinar series. The National Sample Survey is deep in my history. It was the very first data I ever analyzed. So I go back a long time with this, and it's exciting to be able to now be focusing on the 2018 National Sample Survey of Registered Nurses. Now, before I introduce Dave Auerbach, our kickoff speaker, I just will take a minute or two to just a little bit of talk about the NSSRN. This is a national sample survey. It's conducted by the HRSA, the Health Resources and Services Administration. And this survey actually began way back in 1977. And it was repeated in 1980, 84, 88, 92, 96, 2000, 2004, 2008. And then it was sort of suspended for a while, but now we're back at 2018. So these samples each roughly have around 30,000 registered nurses that provide information to the sample or on the survey. And that survey is primarily focused on descriptive data. It's looking at the demographic characteristics of the workforce, the educational attainment, the employment and economic aspects of nursing. And you can get data on the location of nurses, as well as their certifications and licensures. Now, because there are large sample sizes, there's a lot of interesting data that is available to analyze for various types of analyses. And you can go back over time and do trend analysis to see how, let's say, the RN gender makeup is changed, or the age distributions, or other aspects of the nursing profession. So it provides rich information. And over time, each of these surveys is improved. It's improved both in the technical components of developing sample frames and administering the sample, improvements there. And secondly, in improvements on the content of the survey questions. And over time, you'll see different questions come into the survey that provide rich information as well. So a lot of ongoing efforts for improvement of the survey. Now, Today, we're going to be focusing on the national sample survey that was done, the 2018 survey. And it again provides a treasure load of data. And it's exciting because it's over samples advanced practice nurses. And Dave will be talking about that in a minute. But this is something exciting and different with this survey. And it really is a pleasure that Dave Auerbach is our lead speaker. I've worked with Dave for 20 years, and I want to disclose that I was part of the project that Dave is going to be discussing. So I wanted to be clear about that. Let me tell you some things about Dave that you may not know. He had graduated from with his PhD from Harvard University, and his focus of his PhD was on long-term care and aging. And from completing his PhD, he then went to the Congressional Budget Office. He was a principal analyst there. He was deeply involved in analyzing the insurance provisions of the Affordable Care Act. From there, Dave went on to the RAND Corporation, and he became very much involved in a variety of issues, but particularly around DNPs and nursing education, scope of practice and nurse practitioners, a number of studies looking at primary care models and organization. And then following that, Dave went to Massachusetts in 2014, where he became the deputy director and is now the senior director for research at the Massachusetts Health Policy Commission. He continues to do research on the nursing workforce and other aspects. So without any further ado, I'll pass the microphone and the screen over to Dave, and we'll talk a little bit later. Thank you, Dave.
Okay. Thank you, Pete. Thank you for that great introduction. And hello, everybody. Thanks for joining me. Okay, so I will try to talk until around 3:30 to make sure we have a lot of time for questions. And thank you, David Armstrong. I'm glad to be able to help kick off this series. It's going to be great. And in this edition, we're talking about, as you see, weighting issues associated with the 2018 NSSRN. And the subtitle there is important. This is not a lengthy seminar on the technical ins and outs of survey weighting, but it's really issues through the lens of what is the diversity of the nursing workforce with regard to race and ethnicity. So think through that lens, and that's what I'm going to be mostly talking about, but some of the issues extend to weighting in general. And let's go. Okay, so why is this an important topic even? Why do we care about the racial and ethnic diversity in the nursing workforce? I probably don't have to work too hard to convince you that that's important, but you can see this this quote from an IOM paper from 2004, the greater diversity among health professionals is associated with improved access to care for racial and ethnic minorities, greater patient choice and satisfaction, better patient-provider communication, better educational experiences for students. And that's been pretty well established. In 2015, the National Academy came back to this from the famous 2010s to the Medicine Report on the Future of Nursing. A more diverse workforce will help better meet current and future healthcare needs. And there has been lots of research since then, including this last paper that some of you might have seen, finding an actual mortality effect of concordance of provider and patient. And so, given that this is a really important topic, it's important to be able to measure it accurately. So what do we currently know about racial and ethnic diversity in the nursing workforce? And that's really the subject of most of the discussion today. What do we know? And the answer is it kind of depends, but we're going to try to come to somewhat of a consensus. So let's go back to 2008. The National Sample Survey, and I'll talk a little bit more about this as we get into it, has historically been the best source of information on the nursing workforce, or one of. And in the 2008 survey, HRSA typically publishes sort of a summary and digest of the results of the survey. And this is from that. And you can see in this graphic they released, they're comparing the nursing workforce to the US population. people often compare to maybe the working age population, but in any case, you can see Hispanic, Latino, and Black African American, that nurses were far below the US proportion, and the nursing workforce was disproportionately white. You can see that on the bottom. And so that's kind of where one of the best early sources of information where we were kind of starting from. Then a couple of years later, and along with Pete's team, we've been exploring both the NSSRN and also the census data to understand the nursing workforce. And in our work on the census data, we were finding some differences, and we wrote a paper in 2010 to try to understand why was the NSSRN getting different results from the census in some areas. And you can see some of the key results there. We found, like the NSSRN, we agreed that Hispanics were underrepresented in the nursing workforce. But Black African American RNs, not as much. And you can see in that graph 3B, where we're comparing the NSSRNs over time in those black dots, what percent of nurses are Black? And NSSRN was getting around 5%, whereas CPS and ACS were more like 10, which is closer to the proportion in the US population. We also found some differences in marital status, not much difference in terms of male, female, but also a difference in age. The CPS, ACS were finding a larger proportion of nurses were under age 30. That's probably the easiest one to explain, as we'll get into understanding how the two surveys are conducted and where they pull their their sampling frame from. So there were some differences there that we identified. And I think the folks at HRSA read this paper and thought about that. Now then it turns out, as Pete mentioned, what happened was the 2008 NSSRN was the end, and it was discontinued for a while. So from this graph though, we note that the 2015 IOM paper used data from the American Community Survey and said, yes, Hispanics and Latinos are far underrepresented in the nursing workforce, about 5% compared to 15% of the working age population. This is a problem. And HRSA, which in the meantime, when the NSSRN had become outdated, around 2014, they had started using the ACS as well for their workforce estimates and for their forecasting. And this was part of a paper that they published in 2017, finding, yes, Hispanic RNs, as I circled there, were about 6% of RNs, and Black RNs were about 11%. So, and those are numbers from the ACS, and okay. So that was sort of the state of the world in the mid 2010s as we tended to understand it. And then what happened was, once the 2018 NSSRN was brought back online, and we were all very excited, and as HRSA published the kind of digest of the top line results, the graphic on race and ethnicity, as you can see here on the top, found Hispanic, Latino RNs about 10%, and Black non-Hispanic RNs about 7.8%. So that is really pretty much opposite to what we had here. And that was surprising to our team when we first saw that result. And they found that below, they were kind of doing it by cohort and found that more recent cohorts of entering RNs were as much as 20% Hispanic. So that seemed really surprising. So we went back, and that really was the genesis of this paper in this study. So again, why is this important? Why do we care about this? If it's given that it's a goal to have a diverse nursing workforce, we need to be able to measure and understand where we are, so we know how we are doing towards that goal. And that is helpful to send messages to educational institutions, to policymakers, and say, look, we should think about ways to increase the diversity if in fact we're less diverse than we want to be. And so I'm going to talk a little more in detail about these two data sources that I'm then going to compare throughout this paper and see what we can learn. And I will bring in some additional data sources as well. So here's kind of a simple comparison of the NSSRN and the ACS in kind of a side-by-side way. It turns out they both, in each iteration, get about the same number of RNs. The NSSRN gets responses from about 35,000 RNs, which is about 1% of the RN workforce. 2018 was a little different, but that's about the size of it. And the ACS is a 1% sample of the full US population, about 3 million people surveyed each year. The NSSRN, rich practice detail, demographic, educational data on RNs. And the ACS is asking about work, income, housing, race, ethnicity, family structure, and all kinds of demographics. The NSSRN sampling frame, this is a key difference, is developed mostly based on licensure lists that they get from the states, compiled through NCSBN. Okay, and the ACS is getting its sample from long developed ways to get a representative sample based on household units in the US. And as we know, the NSSRN was conducted from 1977 to 2008, and then paused, and then came back in 2018. And the ACS began in full force in 2005. The NSSRN has about a 50% response rate. In the 2018 edition, there was a large oversampling of NPs. And I'll get to that last point about imputing race ethnicity to the sampling frame, which was a new innovation in 2018. Okay. But the ACS gets a very high response rate, and that's part of why it sort of is the gold standard for demographic information in the US. So, kind of reiterating some of the pros and cons, the National Sample Survey, it is a nursing specific survey. So whereas the ACS might ask about generic bachelor's degrees or associate degrees, the NSSRN is getting at exactly, the nursing specific degrees you have and when you got them. And even the diploma programs, which the ACS can't really handle at all. It's sort of a weird nursing thing that is mostly phased out by now, but in any case, in the National Sample Survey, you have an RN. They're plucked from the licensing lists. And in the ACS, they figure out your occupation based on the nature of the work that you do. So it is, from all the comparisons we've done over the years, it is mostly RNs, not 100%. Some people may be misclassified. And some cons from the National Sample Survey really come from the sampling frame, that it might not be representative of all RNs. It's pretty darn close. But one thing we found in that earlier study was that, for example, if you were just licensed and just started practicing, you might not have found your way into those lists that the survey is then pulling from, and there's some lag time between when they get those lists and when they then draw up their questionnaire. And they'll miss some of those newly practicing RNs. So they miss some on the young end. And the response rate of about 50% could mean that if certain groups are less likely to fill out the questionnaire than others, then it's possible that my end results will have some non-response bias. And all surveys, well, most surveys have this problem, not so much in the ACS, but there are ways to deal with that. But an issue that came up with the National Sample Survey, of course, is, well, if I don't have, I know your age in the sampling frame, and I can adjust for the fact that if younger people are not filling out the questionnaire. But those licensure lists they don't typically ask people their race or ethnicity. So if I don't know that, it's very hard to correct that for that if I have a differential non-response. So we'll get back to that. Okay, so what I'm going to do in this exercise is do some comparisons between the two surveys, ACS and NSSRN. We've done some things to try to make them as comparable as possible. The NSSRN questions were asked as of December 31st, 2017. So I've pooled the 17 and 18 ACSs together to create a bigger sample and match that time frame. In the ACS, we defined an FTE based on usual weekly hours worked, and in the National Sample Survey, something comparable, 2,000 annual hours, and then a few other tweaks to try to make them the same. And note, race and ethnicity are asked in exactly the same way across the survey, so that shouldn't be a source of difference. Just to give you a sense of the sample sizes we have here, the ACS in the orange, about 77,000 RNs, and in the NSSRN, about 28,000, big samples. The NPs, there are fewer in the ACS, and in the National Sample Survey, they deliberately oversampled NPs in 2018, so there's quite a lot of them. But when you use the sampling weights and get the total workforce size, as you see on the right, they're about the same. Okay, so key result, here's the main thing. this is the minority representation in the nursing workforce, according to the two surveys. And you see 95% confidence interval bars there, and you see, right away, as expected, these are very different. The National Sample Survey has about 50% more Hispanic RNs than the ACS. And if you turn that into actual numbers, it's about 330,000 versus 220,000. And the NSSRN is also having fewer Black African American RNs and fewer Asian RNs than the ACS. So I'm going to keep coming back to and cutting this result in different ways. If you look at NPs, you see pretty much the same kinds of differences. Not much difference in Black African American NPs, but Hispanic NPs, very big difference. Almost twice as many in the NSSRN. And again, this is using the survey weights. And so now the results that are going to follow are mostly RNs and not NPs. That's where, that's just the cut I'm going to be making. And focusing just on the Hispanic difference, if we look across states, here are sort of the 10 biggest states in the US, and you can see that that difference is systematic. California, 25% versus 14, in Texas, about 30 versus 20. So you see this kind of roughly 50% differential or more, depending, it doesn't matter what state you look in, it's systematic across. Here's an over time view. And so here I've plotted the ACS percent of RNs that are Hispanic in every year from 08 to 2018. And you do see this general rise, which is great news. And you see in 2008, the two surveys were fairly close. And then by 2018, that's the difference that we started out with, about 11.1 versus 7.5. And a key point here is that that increase from 4.1 to 11.1 just really isn't possible. I did some simulations noted on the bottom that finds that if you really were to have the percent of RNs that are Hispanic to grow that much over 10 years, you would have to have a tremendous amount of entering classes being Hispanic. It would have to be about 20% of all entering classes. And from what we know from other data, it's really about 10%. Here's shifting to data from the AACN on enrollees in bachelor's level programs by race ethnicity. You can see the percent Hispanic in the gray. That's about the 10% I was referring to. It was about 6% in 09, and then it kind of grows pretty impressively to about 12% by 2018. So that rate of entry is pretty unlikely to be 20%. Okay. Here's again, using that same data as kind of a third-party verification source of what we were seeing before. Here to make this comparison to the NSSRN, I pulled BSN enrollees from 2013 to 15 from the AACN data and compared them to BSN graduates in the NSSRN from 2015 and beyond. So it should be roughly the same population. And once again, the percent Hispanic in the NSSRN is about 50% higher than in the enrollment data. And a bit lower in Black and lower in Asian, which is what we saw in the same comparisons with the ACS. We obtained one additional third-party data source from Jean Moore. Thank you very much. I think you're on the call. It's just another way to try to verify this. And this was data from the New York NP registration system. And there we find again the same pattern that the NSSRN, when you look at New York NPs, using the survey weights, were about 9% Hispanic, but from the New York data, in the orange, it was about 5%. Okay. So I know I just have a couple more minutes, but here's the key thing that led us to focus on the weights. When you look at the unweighted data, just the straight up survey responses in the National Sample Survey, you see something very different. That only about 4.4% of RN respondents were Hispanic. And then when you apply the weights, then that becomes 11.1%. So it's not that the unweighted data is telling a different story. It's all about the weights. How do we get from 4% to 11%? And that's really the issue. Just mechanically, they obviously have higher weights. And here you can see this average survey weights applied to RNs in the survey by race ethnicity. And you can see that the average survey weight of a Hispanic RN was about 3 times the, the survey weight of a white RN. And even though it makes sense that there's probably some Hispanics might be less likely to respond to the survey, a factor of 3 is probably too high. You know, the 4.4% there, that is below what we expected from the ACS. You know, maybe more like 6-7%. So there probably is some differential non-response among Hispanic RNs, but it seems like the weighting process probably overshot and then went too high. And we don't know exactly why that is. I'm sure it's very complicated. We had some conversations a while ago with folks from HRSA and folks from the census. And here's a little more on the innovation in the 2018 data was a great idea. They talked with the census folks, and I'm sure people on the call understand this better than I do, but said, look, we don't know the race or ethnicity of these RNs in our sampling frame. It would be great if we did. And they conducted this survey with folks from census who said, well, look, we have identifying info, maybe like your social security number. We can go into other census records, find the same folks, find their race ethnicity from some other record, and then just impute that back into your sampling frame. Then you'll know, you know, then you have a good sense of the race ethnicity of these folks, and you can do your weighting much better. So when we talked to everybody on the call, they seem to imply that for some reason, though that matching process didn't seem to work out perfectly. A lot of people, I think, when they responded to the survey and said, yes, I'm Hispanic, that didn't match the census imputed race ethnicity. But we really don't know a lot about that. They were not able to share the direct data with us about that. So I'm sure that caused complications in trying to get these weights right. In the technical documentation, in the second bullet there, HRSA did note that the Hispanics were likely overestimated in the weights by 19%. And I don't know exactly how that came out. The weighting is a very complicated process, and maybe that was the best that they could do. But again, what we're finding is that the overestimation appears to be more than that, but maybe closer to 50%. But again, what does this really mean? In 1 minute, I'll try to go through some of the implications of this. If you are trying to estimate the racial ethnic composition of the nursing workforce, this is where I think you could have a problem. But that's only one thing. The NSSRN is an amazing survey that is telling us a million things we wouldn't know otherwise. For example, here's a question I walked through just a few minutes ago. And let's say that I wanted to ask, what % of NPs had an associate's degree in nursing as their first nursing degree rather than a bachelor's? Okay, that's a question you can really only answer with the NSSRN. Now that's a question where there are more Hispanic NPs for whom that's true than non-Hispanic NPs. Not by a lot, but here's a situation where we might have some bias if the question we're asking is strongly correlated with race ethnicity. That's the only way you might have a problem. And in that case, it's really not that big a deal. So Hispanic NPs, again, are about 3.5% of NPs without the weights, 9.4% with the weights, and that's probably overshooting. The truth is probably in between. So what does that do to my final answer of this question? Well, if I use the unweighted estimates, I would say 28.1%. Then I apply the weights, and the answer is 28.8%. And again, that is probably too high because those Hispanic NPs are overrepresented in my numerator, in these associate degree to NP folks. There's more Hispanics there, their weights are too high. My final answer is too high, but not by a ton, okay? So for a question like this, it depends on how accurate you really feel like you need to be. But, if I have questions like within race ethnicity, if I want to know, well, what % of RNs have their highest education as a bachelor's degree? Very important question. And if I segment within race ethnicity, whether I look at the ACS or the NSSRN, the answers are the same, doesn't matter. Okay, so implications depends on the question you want to ask. And there you go. Okay. All right, I made it. This was just a final graphic on just the age distribution if anybody is interested in that. But thank you. Happy to take any questions there might be.
All right, thank you, David. With that said, Peter, do you have any comments on David's presentation you'd like to share?
Thanks, David, and thank you, Dave. Knowing a little bit about this, I think there was a lot of information that came at us pretty quickly. And I think, Dave, I would ask maybe if you could sort of go back to that final implication and just slowly walk us through that again, because I would hate to think that somebody might be going, oh my gosh, I can't do anything with this survey if it has to do with race or looking at racial composition. Because I think we're not saying that. We're saying that in particular types of questions, you need to be very cautious in that. So I just want to be sure people are on target with that. Could you take another crack at that?
Yeah, I know I went really quickly through this slide. So just to kind of reiterate, slowly. If what I'm doing is trying to estimate what is the racial ethnic composition of the nursing workforce, then I think you should take the current weighted results from the NSSRN with a grain of salt. And they might not be getting you the right answer depending on how accurate you want to be. That's the kind of the biggest problem currently. But on the other extreme, if I'm asking questions like within a racial ethnic group, and then pick a question, then I think you probably don't have a problem at all, because it's, given that I said in the survey that I am Hispanic or that I am Black or African American, there should be nothing wrong with my responses to other questions. So in that second bullet, I'm arguing there's really no problem at all. But most of the things people want to do with the survey are probably in between, not the first question or not the second question, but all the kinds of issues that, that reflect the full richness of the survey. In there, the answer really depends on how correlated is my question of interest with race ethnicity. If I have a question that, I really expect that, and you can kind of observe this, if you're asking a question that has a very strong correlation, so that maybe it's much more likely that Hispanics RNs would say yes to this than other groups, then I'm probably my answer using the weights is gonna be a little bit too high. And the converse, if in my question, it's gonna be much more likely to be true for, let's say, non-Hispanic RNs, white or African American, then my answer might be a little bit too low. And it just depends on the strength of that correlation. And for a lot of questions, there's probably not much correlation at all, and then it shouldn't be much of an issue. So just, I would go at this with just the sense that Hispanic RNs are a bit overweighted. And, exactly how much, it's really hard to say, but at least in comparisons with the ACS, it suggests maybe 50%.
Hey, David.
Yeah.
Yes, thank you. And we do have a few questions from our audience. And just a reminder to everyone, we are recording this event. So if for some reason you have to jump off because you have another call, this recording will be available on its entirety on our website in about a week. With that said, and sorry if I missed it, are there any actions being taken to revise the weights that we should be aware of?
Great question. And that's something that, in fact, we're going to continue to talk to HRSA folks who designed the survey, even right after this call. And I don't know. I mean, it seems like that's something that theoretically should be possible, but I don't know the ins and outs of really how difficult that would be to have to go back and revise them. But theoretically, it should be possible.
Okay, great. And just for clarification too, are there any other problematic areas of the survey that we should be aware of besides, the weighting issues with race ethnicity?
That's a good question. I'd almost want to pitch that back to you, David, because I mean, you've been compiling, more substantive issues with some of the questions that people might have found ambiguous or hard to respond to. Do do you want to talk about that effort a bit?
You know, I don't have anything specifically ready to say. And to be
Yeah.
honest with you, I want you to be the star of this show, not me.
Sure.
But gee, thanks, David. But no, just a little bit that HRSA presently is planning to fill the NSSRN again in 2022. And they are looking to revise the survey with input from health workforce experts. And I'll just leave it at that for now.
That sounds great. But I will also say that we are under review with a couple of papers using the data. It is just, again, we're so thankful that HRSA decided to come back to the survey, because we are now able to learn things that were really just a black hole. And in one of these efforts, we've been looking at the length of time people take between their initial RN education when they become an NP. It's just been we had a sense that this timing was becoming shorter, but there was just no reliable way to know that without the NSSRN. And now there it is. And we are writing a paper on this, and the findings you should be able to see fairly soon. And it's exciting, and it's important. It has real implications for the primary care workforce, which is such a critical question in the future.
David, I might weigh in on this and just say that we actually have a paper under review that a lot of what Dave has presented is discussed in that paper. So folks can hopefully look at this publication and digest it a little bit more slowly than in a quick hitting webinar. So we're hopeful that that will be published and be helpful to the field.
Okay. Oh, here's a question too, and there's a number of questions here, so I hope we can get to them all, but we'll have to see. Have you discussed your findings with the National Association of Hispanic Nurse Leaders?
No, and that's a great question. Even giving this webinar, and as Pete mentioned, some of this work is currently under a journal review and a back and forth. I would like to be just a little more confident before probably coming to them. And I'm really happy that we're getting some feedback here, but no, I think that sounds like a fantastic idea.
Yeah, I guess kind of along on all these lines, what recommendations would you have to ensure that the next data collection process will have better weights?
I think part of why we wanted to discuss this and even write this paper was to make sure that all the folks who have touched on this issue and have experience with it, make sure to really come back together, talk it through, share everything they know to try to improve this for the next round, because there's no reason that shouldn't be possible. I mean, we are living in in a pandemic right now, and there's a lot of important things that are happening, but I can't answer that question from a minute specific standpoint, but I do think that the people who are smarter than me about survey design and weighting, I think can get together and tackle this.
Okay. Here's another question. What are your recommendations for presenting results related to race ethnicity? Seems like more explanation of the possible correlations and the effects of the weight would be necessary, and maybe the weight at 95% confidence intervals aren't always appropriate given this situation.
Yeah, I think that I think that for the kind of potential bias we're talking about, the confidence intervals it's not sampling error. The confidence intervals aren't going to help you. So if I was writing a paper, let's say, and I wanted to present some characteristic of RNs, and I was going to have a table of, the percentage who were of each, racial ethnic category, that's a case where I might just not have that breakdown, or would have an asterisk, something like that. Beyond that, I would just look at the unweighted estimates, look at the weighted estimates, and see if you really feel like it's making a big difference. And then just consider if you feel like you need to, caveat that response. With again, in this example that I went through, with the understanding that the unweighted estimates are also probably not right, and that the right answer is probably somewhere in between there. But that would give you a sense of the magnitude you're talking about as you're working up your analysis.
And one more kind of like really specific question here regarding the weighting issue. Does it help to exclude those with imputed data, or is it all about just the weights? Is that something you've looked into?
That is not something that I've really looked into, and it's a good suggestion. That's probably something that we could do. Yeah, that's a great question.
Okay, I hate to do that, but we're almost at the 45-minute mark, and I really don't think we can go longer than that. I believe that's what we agreed upon. With that said, though, David, and I apologize for those of you whose questions we didn't get to. Thank you. With that said, though, David, do you have like one takeaway point you want our audience members to have? That is, if people come away from this with one point they remember, what is it?
I think this is, well, yeah, that's a good question. I mean, this is a good slide to think about, but that's kind of technical. I would almost want to say, I think something that's really important is this trend, is that the minority representation of the nursing workforce, especially among Hispanics, is growing. It's undoubtedly growing. And I think that that's great news. And I think this is great confirmation of that. And I would just say, with regard to using the sample survey, depending on the question you're asking, keep this in mind and, adjust appropriately. But for most cases, it's going to be a great source of data.
Yeah, and I think in my mind, that's the main thing to keep in mind. This is a great source of data. I mean, it's really one of the best sources of information we have on the health workforce period out there. And so for that, we are truly grateful for HRSA starting to conduct this survey again. Mm-hmm. Peter, do you have any closing thoughts?
Only that, as I mentioned early on, HRSA has a history of updating and improving their surveys. Mm-hmm. And I look at this as part of a long series of improvements. We're pointing out something that I think is important, particularly in today's world. Because if one were to take these results, say, on Hispanics, it's conceivable somebody may say, well, we can back off now on our efforts to improve Hispanics. And maybe we can use our resources somewhere else. That's the misleading aspects that could occur, and that could have kind of the contrary expectations. We really want to have just clean up the accuracy on all of our racial characteristics, so that we really do inform policy on this important area much more accurately.
Okay, thank you, Peter. And with that said, I think we'll go ahead and end today's event. Thank you for watching the webinar. To view our extensive webinar library and other helpful resources, please visit us at healthworkforceta.org.